In 2004, the DMC invoked the 29-minute guarantee. Come to one of our emergency rooms and you will be seen by a physician in 29 minutes or less. Well, that program is still going strong, and now there's an even greater accountability, with live ER wait times posted at dmc.org. So, with all this accountability, we thought we'd take a look at why this guarantee is important and how it's accomplished.
Our philosophy was that patients should not wait to see an emergency physician. We were encountering increasing numbers of medical and traumatic conditions where what we did during the first 30 to 60 minutes made a huge difference in the patient's outcome. So we became very committed to making sure that patients were seen as quickly as possible.
Another hospital in the area, we're seeing patients within 30 minutes, so we thought we could do one better and see them in 29 minutes.
It required a top-down approach, really, to make this work for the whole system.
We got buy-in from the entire hospital.
From our CEO down to every person who works in the emergency department.
And all of the ancillary departments, radiology, the lab, even in-house nursing.
We really had to look at all of our processes in great detail, everything from our space utilization to how we were doing our laboratory studies. Everything was examined. We cut out the areas that were wasteful and really tried to make things as efficient as possible.
And that's what happened. The process review brought about improvements like bedside registration, for example.
Good morning, Ms. Mason. My name is Judy. I'm going to be a nurse for today.
So rather than have people wait in the waiting room at a desk to be registered, our registration clerks come right to the bedside. And we've already started our medical assessment of the patient, and someone else is doing the paperwork concurrently.
Another example is the implementation of an electronic medical record system.
The physicians can put in their orders, and immediately the nursing staff and the other ancillary folks are able to see the orders, and they can act on them quickly.
We no longer have to call for paper charts in our medical records department to look at the patient's past history. We have that right here in front of us.
In cases where there is the need for a very specialized opinion, they are expedited by the use of this robot.
We can bring the robot to the bedside and connect with an expert who can actually talk to the patient and examine the patient remotely. And this really brings us to a much more efficient diagnostic point, so we can start treatments much more quickly in some situations.
Beyond the treatment room, other process improvements were put in place to help reduce the time it takes to treat an emergency patient.
There's frequent studies that we do for patients in the ED, and they shaved off or streamlined some of their steps that it takes to get the results to us in a timely fashion. There's a lot of labs that we can expect the results to come back within 15 minutes. Radiology hired some transporters to actually come pick up the patients and have them there waiting outside of the door so they could get them in to do the test quicker, as opposed to picking them up one by one.
All of these efforts point to one thing.
It required a huge shift in how we did things, a lot of teamwork.
It's teamwork. It's all about teamwork.
So, what is the patient experience with all of these efforts in place to meet the 29-minute goal?
The patient can present in two different ways, either via ambulance or walk-in triage.
They're seen right away by one of our triage nurses.
We get just the bare basics.
We call mini registrations.
The necessary information that we need to get the patient from triage to the doc,
which allows the patient to be enrolled into our electronic medical record system.
So once they're triaged and sent to the treatment area, that's where we do the complete registration.
They're seen by a physician.
The patients are quickly moved through the system.
And the workup from there is what you would expect in terms of ordering tests on the patient, reviewing the results of those tests, and then deciding what the best treatment is and whether the patient needs to be admitted or they would be able to go home. The most important thing for us is to be able to quickly lay our eyes and our hands on a patient and to be able to see firsthand how sick they are and what we need to do, and to start fixing the problem right away. So it really relieves our anxiety. We don't have to worry about who's in the waiting room who might suddenly become more sick or deteriorate, we have our patients in front of us, and that's actually very reassuring as a physician.
That's our one reward, you know, is that we have taken care of the patients in crisis, and they get what they need and they move on.
Patients don't like to wait. And I can tell you as a parent, nobody wants to be waiting in a waiting room with a sick child. So a big part of what we do is to provide reassurance. And that's one of the most important parts of our job. So the faster we can do that, to reassure parents that their children are going to be okay, is just a wonderful value for our patients, and they really appreciate that.
To find out more about our 29-minute guarantee and to see live ER wait times, visit dmc.org. I'm Emery King.